The fact that you clicked on this video indicates that either you're suffering from frozen shoulder, or you want to prevent frozen shoulder, or you're just curious about what is frozen shoulder. In any case, this video will not disappoint you provided you stay with me till the end of the video, and I assure you, you will know inside out of frozen shoulder. And not only that, I will also teach you some basic exercises that you can do to have a healthy shoulder. Welcome to Becoming Wiser, and today we are going to talk about adhesive capsulitis, that is frozen shoulder. So today we are going to talk about adhesive capsulitis, which also known as frozen shoulder in common terms. So what is frozen shoulder? Frozen shoulder is a disorder which starts with pain in the shoulder. It's a pain that radiates from your neck all the way to the shoulder, and sometimes it even radiates to your elbow. So this pain is so severe that you cannot lift your hand in any of the directions. So when you lift your hand up, sideways, front, back, or you even try to comb your hair or wear your clothes, it becomes very difficult and it starts paining. So the pain is the first indication that you might have a frozen shoulder in future. It is not frozen shoulder yet. You can know from the word frozen means you cannot move it. It is hard. But yet now you're just having pain. So this is the right moment to actually understand what frozen shoulder is and find a suitable treatment for it. So before it actually begins to become a chronic ailment that we term as adhesive capsulitis. So it starts very simple, that you start getting pain in any one direction or all direction when you move your shoulder. So muscles which are involved in flexion, extension, abduction, adduction, rear extension, all these muscles that do these movements starting to get pain. Why does it happen? First, let us look at the Western medicine perspective of it, and then we slowly move to the TCM concept. What causes this frozen shoulder? So let us begin with Western medicine. First of all, when you start getting pain, it is mainly few muscles or few tendons that are getting stiffened, and it starts getting pain, and mainly it occurs from the neck. So there are cervical nerves that supply to your hand, and this cervical nerves, due to cervical slip disc or cervical stenosis or various other cervical regions, that you can suffer from pain in your shoulder. At the beginning, it might just look like a pain due to some movement, but it has a root in your neck. So slowly, you start getting pain in your shoulders. And when you start getting pain, it basically indicates that if you don't address it right away, it is going to turn into a very severe condition. It can be divided into a muscular pain, it can be divided into nerve pain, it can be also divided into a type of adhesion in your joint. So how do you distinguish between them? First of all, if you have, when you do a particular movement and your muscle becomes stiff and it pains, then it is mainly due to muscle. If you're lying there, you're doing nothing, or you're working on computer, or you're sleeping and your muscles are in a relaxed position, yet you're having a severe pain running down your shoulders, then it can be due to a nerve pain due to pinching of nerve from your cervical spine. If you do a particular movement and it starts paining, then again you have to see if the person has a relaxed muscle and some external force is moving your muscles, moving your hand. Then if you still feel pain, that means the pain is occurring at your joint level. So now we are going to dive deep into what actually happens. So first it starts with just a nerve pain. Slowly it, as your nerve is getting pinched or you are getting inflammation in the nerve, you have to understand when we talk about capsulitis, itis means it's inflammation. It's a very common thing that we understand today, that itis refers to inflammation. So inflammation of the nerve or inflammation of the capsule, that is the shoulder itself, or the inflammation of the joint or inflammation of the muscles in together, we call it rotator cuff, can lead to these painful symptoms. So, first of all, understand why you started suffering from it. So, the symptoms, as I mentioned, it can be due to movement, you can have pain due to lying in the bed, you can have pain while working, you can have pain without doing anything, it can be continuously radiating pain. They all can come under frozen shoulder as long as it leads to the same prognosis or same end result, that is slowly stiffening of the muscles. So now we come to the frozen part of the shoulder. So what actually happens is slowly as your movements are getting restricted due to pain, you start having less and less movement. The more you move, the more it pains. So you tend to go into a prevention of movement stage. So the body treats your shoulder into not moving. So as you not move, the muscle tend to get stiffer and stiffer and stiffer. So you are not able to perform some basic movement like just going back into your back pocket. Slowly, as your months go by, as you suffer from this pain for months go by, you start realizing that those movements are so restricted, you cannot even perform a movement of your shoulder. Now you can see you were able to lift your shoulder like this, but now those movements are also like as if all the set of muscles, front, back, shoulder blades, everything just moves as one unit. So that is when we call it adhesive capsulitis. It is adhesion. It is like the whole system is kind of stuck together. So at this stage, it becomes a chronic frozen shoulder. For this to happen, it normally takes around 6 months to 8 months, sometimes even a year. So if you have involved yourself in regular exercises, then it might take longer. So as long as there is pain, when it comes to treatment, it is much easier to treat. But if it reaches to a frozen, then it becomes a very difficult thing to treat. So always remember, always visit your nearby doctor when you just have the pain. Now let us come to the TCM perspective. This becomes very interesting when we look at the TCM perspective of it. We call it frozen shoulder, but in Western medicine, we call it frozen is because the joint is stiff. But when you look at the TCM perspective, it becomes very interesting, my friends, because when we say frozen, it has something to do with cold, right? So in TCM, we look at this as a cold wind syndrome. So when the cold wind affects certain points on your body, acupuncture point, which we term as Feng points. Feng points is basically certain points back of your neck. You can see this behind your ears here, in the middle of the head, and certain points on their back, and also certain points near their shoulder. These points are called wind points. The reason they are called wind points is because these points are easily affected by wind. So if you know, earlier in India, old people used to have a muffler that would cover all this area and not just wear something on the ear. The wind or the cold doesn't enter from the ears, but it enters behind the ears. So when you get wind attack from these areas, you suffer from pain in these areas. So why you suffer from pain is because the muscles start to become stiff. When the muscle becomes stiff, tends to compress your nerves, spinal nerve roots that are coming from the spine all the way to your hand. And slowly, it starts becoming a chronic phase. So slowly, when it goes deeper into from your surface skin to your muscle to your tendons to your bones, it becomes more and more chronic. So first thing, prevent it. How to prevent it? I'll give a simple example. When you're working in your office, you have wind blowing from your air conditioners right behind. Many a times you have seen offices where the person is working here and the air conditioner is right behind it. It is like a blade of cold wind that hits this area. And when your internal immunity, what we call zheng qi, that is the protective layer of your body, is strong enough, it doesn't affect you. The day your body's immunity goes down, this has accumulated inside starts slowly producing its root as pain, and slowly it becomes frozen shoulder. Second thing is that when you're driving your car, a lot of times because it is hot inside the car, it's a metal body, so you tend to have the air condition pointed towards you, especially the side blowers. They are right at your face, right at these points. So when you're driving, it is hot outside. You enter your car, you're sweating. All your pores, these points are open. As soon as the wind attacks, understand this. Wind and cold is something has accumulative nature. It won't show its symptoms right away. If you're sensitive enough, if you're aware about your surrounding, then yes. But understand, if you're not aware, this is going to just keep on accumulating in your tendons, in your muscle, in your nerves, slowly, as the age progresses, as your body becomes weak, as you hit certain age, when your body's regenerative capacity, your body's protective chi has gone down, then you are going to start suffering from this kind of disorder we call as frozen shoulder. So, what is the best way to prevent it? First thing, awareness. Be aware that your body has certain level of energy that it protects. So when you are in an air conditioned room, make sure the temperature is always 26 degrees and above, not below that. So a room temperature must be maintained. Never have direct wind on your body, especially when you are coming from a hot condition. When your pores are open, you are sweating. Whenever you're sleeping, your natural yang energy, that is the protective chi, is going down. So at night, prevent direct wind, fan, air condition to your body. So these are the preventative things that you can do. But what if you already start suffering from pain? What are you supposed to do? Well, the best thing is if you can find a acupuncture doctor around you, that is the best thing you can do. Because when you have frozen shoulder, when you start suffering from shoulder pain, acupuncture, right at the moment when you start seeing that changes of energy in your body, right at that moment, if you visit an acupuncture doctor within 2 3 days of your pain, then you will have a miraculous recovery from it. But if you wait and let no, just think, this pain is going to subside, and I'm just going to wait it out, I'm just going to do certain things, like, hot fermentation, this and that, you might make it worse, especially if you do spray or pads and something like that. On top of that, if you take painkillers, it is going to make it worse, because we all know what painkiller does. It just blocks the sensory input to your brain. It is not going to stop this accumulated energy, that block that is occurring in your shoulder. So it is very important. It is very important that you realize that pain is just an alarm telling you that you are suffering from a chronic syndrome, and it is not just something that is, like a temporary thing, just take a painkiller and it's going to go away. So understand, as soon as you get that, don't wait it out, don't let the body, don't take any medication, don't take any kind of temporary thing to avoid it. You can perform certain exercises to prevent this occurrence of pain. But if you have it, best way is to visit a nearby acupuncture doctor or an Ayurvedic doctor or someone who knows what the problem is, and get yourself treated. Now, I will show certain exercises in another video. So make sure that you subscribe to our channel, you stay tuned to it, because these exercises are going to be very important. They are going to help you in long run to prevent any kind of frozen problem, prevent any kind of shoulder pain, so that you have a healthy lifestyle. If you like this information, make sure that you subscribe to our channel. Do press that bell icon, because I'm going to share more information like this, and it might be beneficial to you, not today, not tomorrow, but in near future, where you might want to prevent certain disorders. This video is not about treatment. This video is about awareness so that you can prevent it. And another thing, if you have any doubt, if you want to know about certain disorders, if you want to know about frozen shoulder and other things that can cause shoulder pain, then you do let me know in the comment section and I will make a respective video about it. Also, do comment about what you like about this video, whether you understand the TCM aspect of it better or the Western medicine aspect of it better, which you can connect it better. Well, then let me know so that I can also share more information on that topic. So stay tuned and don't forget to subscribe and stay healthy, stay fit, and do watch my video on the exercises so that you can stay healthy rather than move around to just finding treatment for your chronic ailments. Stay tuned. Thank you and God bless you.